Hi, I'm the ostomy nurse, and today we're talking about the niche colostomy management system called colostomy irrigation. Colostomy irrigation is performed on a routine schedule, preferably at the same time every day or every other day, depending on your bowel habits. The patient will sit on the toilet, insert a lubricated cone into their stoma, and flush it out with between 1 and 2 liters of tap water. This is done slowly over 5 to 10 minutes to prevent cramping. Then the water is retained for about a minute, then the cone is released, and the water and stool are allowed to exit the stoma. Most ostomates choose to use a drainage system so they don't have to position their stoma directly over the toilet and stay seated comfortably. If a patient also uses a two-piece pouching system for security, the base plate or the wafer can be left in place during this procedure. Most of the water and stool returns or empties out of the stoma within 5 to 10 minutes. However, it can take up to a half hour or 45 minutes for all effluent and water to return. After the stool and effluent has passed out of the colon through the stoma and into the toilet, the patient is free to replace their pouching system if desired, or to simply use a stoma cap. This is because the goal of colostomy irrigation is for the patient to be stool-free in between irrigations. This management system will not work for everyone. It works best for folks with left-sided diversions, primarily a descending colostomy or a sigmoid colostomy, and for people who have just 1 to 2 well-formed stools a day. People choose to irrigate their stomas because it gives them a sense of security and freedom that they have some control over when they defecate. There could be cost savings too, as it requires far fewer supplies to irrigate your colostomy than it does to repouch. However, there are some downsides. Many people don't have a lifestyle where they can commit to spending 45 minutes or an hour irrigating their stoma every single or every other morning. Because some air can be introduced to the colon along with the water during irrigation, the patient might experience more flatulence. This can be a no-go. Overall, in my practice, I've found stoma irrigation to be a hard sell. It works very well for a select few people, but a lot of folks don't want to have that kind of routine, intimate encounter with their body on the daily. Another reason folks might not like it, even after trying it, is that they find they get abdominal cramping, as someone might experience with an enema through their rectum. And lastly, there are contraindications, meaning conditions in which you are absolutely not suited to use stoma irrigation to manage your colostomy. These include stenosis of the stoma, meaning that the opening or os is tightened and narrowed, current chemotherapy or radiotherapy treatment, as people experiencing these therapies routinely have diarrhea, and if the patient has a large peristomal hernia or stomal prolapse. If you have a descending or sigmoid colostomy and are interested in colostomy irrigation as a management strategy, please reach out to your local ostomy nurse.